Hello and welcome to our Gold participants and listeners from around the world. I'm Kristin Schwarz, licensed midwife and MC for Gold Learning. And we are here once again back, and this time I have a very special guest. My guest here today is Dr. Crea, who is a naturopathic physician and also a Penobscot woman, and also has a degree in ethnobotany. Welcome, Dr. Just.
Thank you so much for having me today.
It is a pleasure having you, and you will be presenting at our Gold Midwifery Online Conference 2019. The topic of your presentation is Naturopathics in Labor. And I'm very excited to learn more about that as a midwife here, and I'm sure all our listeners are as well. But before we dive into the topic itself, why don't you tell our listeners about yourself, your professional background, your cultural background, and introduce yourself to our listeners here?
Sure. So I have been a practicing naturopathic physician since 2005. I am in my own practice and clinic, and I work with families. I do general family medicine. However, prior to that, basically I got into naturopathic medicine because it connected with my cultural Penobscot background as far as holistic and using natural therapeutics. I began my love for plants at a really young age. So basically it goes back to growing up and being a teenager in the woods and getting to know the plants and developing my relationship with the plants that my ancestors have used for thousands of years. So I actually really credit my ancestors for paving the way for my knowledge of healing and using the plants as medicine. I went to UMass and Amherst and created my own major in ethnobotany and holistic health, and received my bachelor's of science there, and then went on to receive my doctorate in naturopathic medicine. And so from there, I've done a lot of studies also with traditional indigenous practitioners, reclaiming a lot of our Wabanaki traditions and reconnecting with a lot of Anishinaabe elders. That goes back actually with our prophecies as far as reclaiming our healing practices. So over the years I've done a lot of traditional healing work, and also trained in Bemidji, Minnesota with Indigenous Midwives in Indigenous Midwifery as well.
How wonderful. I find it absolutely fascinating also how you describe your relationship with your plants and herbs that came at a very young age through your family and ancestors and such. I can only imagine how I have that picture now in my mind, how you're walking through the woods there and actually almost communicating there with the plants as well. Can you tell us a little bit about your training?
In midwifery or naturopathic medicine, or both?
Both. When you trained with the Indigenous midwives and healers.
Yeah, so with the Indigenous midwives, it's basically reclaiming birthing as ceremony. So a lot of the training is, how we I guess it's very complicated, but just viewing birth as a sacred ceremony, and so treating the woman in that sacred way, and the womb, and the how we would bring that baby into the world. A lot of what I'm going to talk about in this presentation has more to do with the herbal medicine and homeopathics and the naturopathics that is also scientifically based as far as training in naturopathic medical school. So basically the presentation will blend both traditional medicine practices as well as modern naturopathic therapies.
Wonderful. Sounds absolutely beautiful, kind of connecting the two ways there together. And I liked what you said about the birth being a sacred event, and treating the birthing woman also as such, and bringing a baby, a new life into that kind of environment. I can only imagine what does, giving a baby a start like that, and also for the mother, of course, being treated with dignity, respect, and and love. What wonderful foundation that is for the baby coming into the world and also for the new mother going into motherhood, right?
Exactly. So it's a completely different mentality and approach to, birthing, with mainstream kind of obstetrics and medicalized birthing. So it's really taking away the medicalization of birth and birthing as our ancestors have done for thousands of years.
Wonderful. Yeah, you mentioned your presentation, and I'm glad you did that. So jump right in and tell us a little bit what you are presenting about, and yeah, let us just a little overview so we know what we can expect.
Sure. So naturopathic medicine does combine traditional wisdom with scientific research. So a lot of the herbal medicine that I'm going to discuss is based right here in the Northeast, where I come from as an Indigenous woman, as a Penobscot woman here in the Northeast. A lot of our treatments are indigenous plants right here from the Northeast. So a lot of them have research, some of them don't, so it's going to be a blend of both traditional plant knowledge as well as scientifically based research that basically confirms the traditional knowledge that we've always known for thousands of years and the way we've used these plants as our medicine. And then I'm also going to be talking about traditional foods. We're going to, as a holistic and naturopathic approach, we're going to look at a few cultural uses of foods, not just my own indigenous background here as Penobscot, but also other studies that have been done from around the world to show cultural uses of foods for labor and that help assist with labor, ease labor, as well as homeopathics. So we're going to look at holistically through our natural therapeutics, all modalities that as naturopathic physicians we're trained in to be able to use to assist women in labor.
I like how you have worded this as a holistic approach, marrying all these different modalities and coming up with a good way to assist the women in that. I'm very much looking forward to that presentation. I must say I'm a midwife. I have a little bit of knowledge, but not nearly enough. So there's so much to learn, and I'm looking forward to taking some of your suggestions into my own practice. Now, yeah, I didn't want to cut you off. I thought you were saying something there.
Yeah, I find that, as midwives, the more we can expand our birthing bundles and our tools that we have available to us. So depending on where we are in the world, we might have various herbs more available or homeopathics or foods available. So it's going to be, basically as midwives, we'll be able to expand our knowledge and our abilities to use these therapeutics. So I'm going to really get into a lot of detail as far as recipes and
Hmm.
formulas and dosages. And the more we have available, the better our women are.
Absolutely. The more tool, and you're so right about that. The more tools we have, the more we can be of help to our women, and assist them in their journey. Now, one question to you: do you sometimes, in your background there, experience any barriers when it comes to that? I mean, in my little practice here, sometimes, if you suggest something, maybe some women are not familiar with these kind of herbs, and
Yeah.
yeah. So how do we address that? What can we do?
Yes. So in my practice, I approach the woman wherever she's at.
Hmm.
It's always the patient or the woman, the client who's, in charge. So I just offer, suggestions or tell her that we have these things available to us. But
Hmm.
really, the woman is in charge and she
Right.
dictates, what happens. And I'm the hired help just to offer assistance and knowledge and wisdom. And so really it's approaching whoever your client is with wherever they are at.
Absolutely. Sounds wonderful. And now, before I let you go, my last question here today is to you. What are you hoping our delegates will take away from your presentation?
Yeah, so I think it's really important, like I said, to be able to expand our tool bags, to understand these sacred medicines, our traditional plant medicines, the homeopathics, the food as our medicine. So a lot of these natural treatments have huge abilities to help us so that we can minimize medical interventions and so that we can have the most natural births possible. And so I find that it can really help decrease the need for medicalization. And so for me, it's really important knowledge and work.
Thank you so much. And I can't wait for your presentation. And thank you for sitting down here with me and chatting about your background, your journey, and your presentation here with me today, Dr. Jazz.
Yes, thank you so much for having me. I'm looking forward to it.
And to our listeners, Dr. Just presentation, Naturopathics and Labor, will be live as part of the Gold Midwifery online presentation, and she will be presenting live on February 19th. For more information on this presentation and on the other presentations in the conference, and when this conference will be held in your time zone, please visit goldmidwifery.com. Thank you, everyone, for listening. Bye-bye for now.